Coming to our next session, stop reading for a moment these days, and you will miss out on a sector terminology or a new business model. The world's moving faster than ever before. Deep tech fields like AI, advanced materials, blockchain, biotechnology, robotics, drones, photonics, quantum computing, the list is endless. All are moving more and more quickly from early research to market applications. In a sense, it's a new industrial revolution where new platform technologies and infrastructure completely transform the way we live and work. Our third panel discussion therefore focuses on building IP for the world, the next big wave. The panel will be moderated by Mr. Tej Kapoor, Managing Partner, IvyCap Ventures. Ladies and gentlemen, please welcome our panelists, Ms. Meenakshi Singh, founder of Synapsica, Mr. Utsav Mathur, founder of Gmetri, Mr. Kiran Shah, founder of YelloSKYE, Mr. Jason, Director Business Development, Trillbit, and Mr. Tarun Gupta, founder of Lissun. Everyone, a huge round of applause for our panelists. The stage is all yours.
Hello. Thank you. This is better. Thank you everybody, and welcome all of you. I'm the newest and youngest member of, not youngest, the partners of IvyCap, and and we have spoken individually, so it's great to have you here. Why don't we take a couple of minutes and just to talk about your business first?
So, my name's Kiran Shah, co-founder of YelloSKYE. It's a drone-based startup. We do not manufacture drones. We use drones to capture data. We bring ground truth to the desktop, as we call it, and we use that ground truth with this aerial data capture to provide intelligence, business decisions, and risk management to our clients.
Hey everyone, this is Utsav, and I'm the founder of Gmetri. We are a metaverse platform, or you can think of us as a very easy no-code toolkit to build the metaverse. And some of our successes recently include Reliance's AGM, which was held on our platform. We've also served a lot of use cases globally, because that's contextual to the panel today as well, like building PayPal's metaverse, the Pavilion, meant for internal use case, as well as the COVID vaccine manufacturing for several large pharmaceutical companies in the US as well, built in a metaverse environment.
Hi, I'm Tarun. I'm the co-founder for Lissun. Lissun is a mental health platform, which is a full-stack mental health delivery platform. But it is not your traditional mental health app which asks you to do a meditation, etc. We are actually a platform that works very closely with physical health. We integrate mental health into physical health care, and which helps in better outcomes for patients and better patient experience. And partner with healthcare institutions for chronic diseases like infertility, cancer care, nephrology, kidney care, and so on.
Hello. Good afternoon, everyone. I'm Jason Creado. I'm previously worked in the maritime industry as a navigating officer, then moved to tech, and fortunately working with Trillbit right now as a director of business development. Speaking about Trillbit, so we have a team of 25 people, majorly based out in India. And what the technology does is basically we just realized we simply communicate using sound. That's what we are doing right now. And it's a pleasure to be among all of you people to hear, listen, and speak with you. But the same thing can be done with two devices into IoT and all the other machines. All that you need is a speaker and a microphone, right? And the use cases of this is majorly into authentication of people and authentication of things. So we have partnered with companies like Chalo in the bus ticketing section. We have partnered with Oyo for an automatic check-in, and multiple other IoT companies. So that's what we do.
Hi, I'm Meenakshi. I'm co-founder of Synapsica. So we are building a software platform which is AI-driven to automate reporting of radiology scans in spine. What that means is like earlier what a radiologist doctor would do in creating a report identifying diseases in spine, that we can do automatically. So much so that for our products, the doctors just go to the software, review what they're seeing on the screen, click a button, and a report that can go out to the patient gets generated automatically.
Great. So I think it's a common theme. India has always been looked upon as a cost arbitrage opportunity. And I think all of your companies are changing that paradigm. And I think Mr. Kamath spoke about it this morning as well. Now we are moving up the chain in terms of creating IP. And that I think is just the next level India has to mature to. So drones to, Synapsica with their product. So if you can reflect on that, on how you see this change and what particular IP is your company particularly building, which will differentiate you from, and you're competing with the world because all your products are, across the board being sold in the US, etc. So we can start from Synapsica first with Meenakshi.
Yeah, so to put this in perspective, like a lot of automation is coming up in radiology specifically. Obviously, it's coming in healthcare in general. But specifically in our space, what we see is most automating applications, generally what they do is to prioritize which patient scan needs to be looked at first by the doctor. So for example, in a queue of patients, if there is a brain stroke patient, the doctor will see it first, right? Or applications which kind of bring out the ROI that the doctor needs to pay attention to make the diagnosis. We are kind of unique in that sense, and that's really unique about IP. In the sense we do end-to-end reporting, like from the smallest of the things to the biggest of things that can cause back pain, right? And we're able to do that because I think at least to a certain extent, I'll attribute that to us being present in India with the digitization and the availability of data, the costs and the infrastructure significantly gives that a boost.
Yeah, so you want to take with the drones because that's like the talk of the town. Everybody's, except like, wedding pictures to the real world drones. Yeah.
We don't do wedding pictures. We are focused primarily on the infrastructure market. And just more pointed answer to your question about how we are thinking about creating IP. It is related to data. As I said earlier, we position YelloSKYE as a aerial intelligence company. The word aerial obviously comes from drones, but the word intelligence comes from a perspective of giving the business value immediately to the customer after every mission, as we call it internally. But at the same time, what we are doing is, and this has been a vision from day one, we have not deleted a single piece of visual data that we have collected from the time we started the business. Our first target is 200 terabytes of data with relating to the build out of infrastructure, because we actually do monitoring of construction. And we believe that we will have 2 centimeter level pixel data accuracy, 200 terabytes of it, very specific to the industry, very, very contextual, which is very hard to replicate. We will have to mine it. We will have to figure out what we will mine, what people will pay for. That's a separate conversation, but we will have the data. And you can go to Google today, you will find satellite data, you will find lots of other data, but you will not find drone data. And the reason you will not find is because a sensor flying in the air at 20, 30, 50, 100 meters above the ground just did not exist 5 to 6 to 7 years ago. This whole drone buzz, and as you said, very exciting today, has really come into play really about 5, 6, 7 years ago, and it becoming a B2B business has really just come in about 3 to 4 years ago.
Yeah, thank you. Tarun, with your moving from drones to mental health, if drones have data, mental health is very important to analyze the data. So how did you come about it, and what IP, like you went through the routes of doctors. So if you can talk about, how you are building the IP there.
Sure. So if you look at traditional mental health platforms or apps, they have been about connecting the user to the right therapist, and that's been the primary thing. But what we wanted to do was go a step further, and can you build specialized mental health care for, say, chronic diseases? So if I take the example of infertility, or for that matter, nephrology, the kind of stress or mental health care that you will need will be very different than I need for exam stress. So can you look at all that data, create specific digital programs? The one advantage we have in mental health is it is probably the form of healthcare most amenable to be delivered digitally, right? You don't need to see the person every day. You don't need to touch or feel, etc. So what we are doing is building all this, using all this data to create very customized digital programs for people suffering from these issues. And the products help us, one, connecting with the doctor, getting feedbacks, etc. But it also helps us get real-time updates on how it is impacting the person. Should we change the trajectory? And to add on to what Meenakshi said, being in India actually helps us build a lot of this data, build a lot of these digital programs at, I think, 1/3 the cost than if we would have to do at the same scale elsewhere.
Lovely. Now, Utsav, you convinced Mr. Ambani to use your product at the Geo Day, right? So, which is congratulations for that. So I have a couple of questions coming from Tarun. One is, first, if you can explain the audience what exactly your, metaverse and, again, like drones, there's a lot of talk about it. What exactly is, the use cases there? And then, first you can answer that, then I'll come to the next one, yeah.
No, I mean, thanks so much for asking that, because we're a part of a buzzword industry, right? Everyone is hearing about the metaverse, and, and as the buzzword industries go, everybody likes to define it as it best suits their company, because it's still early. The metaverse is actually one of the simplest, it's a really simple concept. It's a natural evolution in the internet itself. It's the Web 3.0. A lot of our work, a lot of our interactions, with people, places, things, data and information are getting online. And in this natural evolution, there has to be, engagement experience stands pretty much at the forefront of it. And that's what the metaverse is. To your point earlier, I mean, what we're doing at Gmetri is we've built a really simple platform that anybody can build their own metaverses. And it's something that we are growing and with a lot of interesting companies using this platform today.
Nice. And one large use case is training, right?
Absolutely. I think, one of the things that is important is how do you actually add value within this entire thing? Because when we're working globally, and I must say this with the context that Gmetri is actually one of the largest metaverse platforms. If you look at Decentraland and Sandbox, we've got 20 times the monthly active users of any of these platforms. And the reason that we have that is because we're driving value. There are three primary ways in which people are deriving it: training, learning, and development. Like I said before, the COVID vaccine manufacturing. But it's also a lot more. We're working with a lot of banks in creating digital ways or digital twins of their facilities to be able to learn and understand it better. There's also the use case that's really strong of employee experience, which is pretty much across the board. And of course, there's the retail vertical. I think these are pretty strong value-driving growth. But like you said, training is definitely one of the most understood and well-researched spaces within the metaverse and its direct applicability.
I feel like we all will live in some kind of a metaverse age in like next 4 to 5 years.
Yes,
to
just
come.
a matter of when, not a matter of if anymore.
Yeah, exactly. It's more like when, right? They're coming to Trillbit, and the very high quality work you're doing. I mean, it's fascinating, how using the tech. I think it's one of the few companies I saw which has building actually real IP. So again, I would love for you to explain like a little bit of use cases and where you're heading with it, especially with that Ring, Amazon Ring you guys have been trying to work with.
Absolutely. So to start with, just to give a couple of use cases that we have, if you all have traveled with the public buses in Mumbai, it's quite a roller coaster ride. I mean, at a much cheaper rate. So what happens out there is that the crowd is huge. The environment is not really great for the ticketing to happen. And much of the hype was when BST buses declared that they would be going digitalized, the tickets. And that happened with Chalo. Now, the only technology that would work really seamlessly was our technology. And that's when we partnered with Chalo and gave the data over sound technology. So we are doing on a daily basis close to about 150,000 transactions with them. The other use case is if you picture when you're just checking into any hotel, the first thing comes to your mind is like, okay, I have to now give the booking ID. I've just come from a very tiring flight and I have to waste time searching for it. What we are doing with them is that just you open the app and the check-in happens automatically. So you have saved a lot of time and your first experience is going to be awesome. And that's what we are doing with Oyo. The third thing which you just mentioned about Ring. So if you must have seen what happens is you have just purchased a doorbell. And when you set it up, you do it in an environment where the network is really good. You have very good internet connection. Now, when you go out, you've just set up your device and you go out and you fix the device and then you realize, okay, that's not functioning. You think it's a really big thing. But you then realize there's just no internet connection out there. It's not really great. And the company has spent a lot of resources in making calls, sending the technician out there for just this small error that happened. So what our technology is doing, it is doing the communication of this doorbell with your device. So you just place it outside. It detects where the internet speed or the network of the Wi-Fi is really great. And that's where you can fix it out. And it saves a lot of cost and the hassle around it.
Yeah, makes sense. Coming back to Meenakshi, I think there are a couple of questions I want. One is you're changing the whole radiology industry in a way, how it's been looked upon. And second is, and that's more for everybody, like as you're building these, deep IP, deep tech kind of products, how's the talent in India? So we'll start with Meenakshi, first with radiology and then come to talent. How you're changing the radiology, as an industry overall.
Yeah, so the talk that is very common in the radiology space is basically if AI is going to replace doctors, right? And there are, like the width of that discussion ranges from a strong yes to never, right? But one thing that's definitely happening is that radiologists, more and more radiologists are getting trained to work with AI products. There are education systems that will help radiologists learn about artificial intelligence or conduct researches in that area. So that's happening. From the consumer perspective, the cost of radiology reporting is coming down. The quality of reports is improving, and I emphasize quality because the reported inter-observer variability for radiology reporting is generally 30%, right? And for spine, the area where we are working on, it's 50%. So what that really translates to, every second report, two radiologists wouldn't agree what the findings are, right? And that's significant for a healthcare diagnostic service, right? And that needs to change. So from a consumer perspective, that's how it affects, right? Technology like ours is significantly transforming how healthcare works in that sense, like the cost of it, the quality of it, and etc.
Got it. Now switching to talent, because I think talent is a big need, and drones is new, mental health, been there, but I think those were mostly pundits who were doing mental health. Now it's the real mental health. So, and same Trillbit. I mean, so do you find enough talent, like the right kind of engineering talent, vision talent, etc. in India? So I would love to hear your thoughts on it.
I would say the simple answer is potentially no. It's not easy. I'm quite sure it's out there. I'm not yet that worried about the expense, but finding talent is difficult. I have this view. that the actual mining of data will get commoditized. So therefore, the data that you have is more important than the mining piece of it. Google already has services which does some basic mining. You can see it on your iPhone to a certain extent, whether it's by date or by color. You can see a color and all images which have that color will show up. And that will only get better and better. That's my view. I could be wrong. So for us, the primary is the data itself. It is very, very challenging. Maybe I understated it, to find talent, especially because we are a startup. We're still very new, and therefore it's that much more difficult. But I do believe the actual mining piece should get easier and easier, because you will find people commoditizing it and giving it to you in about 2 to 3 years' time.
I just want to say we have IIT deans, ex-deans, and a lot of IIT folks, and they can help with some of the talent piece.
Yes, absolutely. So I come from the context of course, hiring is extremely, extremely tough in India, but it's not only for us. There is the challenge of hiring somebody in emerging technology, but also that is compounded by the kind of product that we are. We're a design platform. We're meant for designers to create virtual worlds, which is also not very traditional to come out of India. I mean, if you see, there are no major design platforms out there meant for designers. That's just a product category that's also very new. So for us, again, hiring becomes very difficult. But tech talent, I guess there's no other place like India from a lot of perspectives. The first, of course, is that we do have a lot of enthusiasts, so people who learn and pick up a lot of serious skills themselves. I'm not saying that these technologies are not followed abroad, but over here you'll have somebody who'll have practiced and gone a little bit into detail, and we do get a few of those enthusiasts. So I mean, one of our hiring strategies, of course, would be to go for people who already have a little bit of an enthusiasm within the space. And thankfully, in emerging tech, at least there are people who would significantly be able to do that. So our design talent, for example, sits out of South America and Peru, and that's the more natural geography to find them. But for a technology talent, I mean, that's where you want to kind of hire from.
Would you then open up offices in, like you're planning, or you are moving to San Francisco, or you're already there? So like, to find the right, and drone talent, a lot of that is in Israel. So do you guys plan to, hire talent there?
Yeah, absolutely. I mean, you also want to hire locally as much as possible for, for that geography. If you were to look at the, San Francisco, for example, there are some great people and great talent resources which come at a significant multiplier even today. As long as you're serving that geography, yes, I mean, we want to grow that out. But we are, I mean, from my perspective at least, we are a company that's looking to grow in the US from a sales and marketing and a client's perspective. So I would, definitely hire sales and marketing from there. But our technology teams, again, my co-founder Sahil's here. He leads the technology team. He has had a fair bunch of challenges as well that he could highlight.
Tarun,
Yeah, so I think most people here will talk about engineering talent. We face the same challenges, we find the same availability, but I'll talk about the other kind of talent that we need, which is good psychologists. And in a country where psychology traditionally has been either looked down upon or not been paid really well, that is a talent that we actually work a lot on to make sure that we become that platform of choice, remove that arbitrage of, people. Actually, there was a 50% drop-off for psychology postgraduates who were not working in psychology but doing something else because of the pay gap. So there is a lot of talent, but right now we invest in cultivating a lot of that talent so we can build this expertise-led solution that we have. Engineering, everyone knows there is talent available, but the challenges with hiring right now. So the approach we've taken actually is, it's a hybrid approach of our own team, but we also partner with specialized technology companies which build tech for what we call as digital therapeutics. So it's a mix so that you are not always dependent on your ability to hire. And then, we all know what happens post-hiring in India.
yeah.
So what I would also add on to it is that there is talent out there, but finding the right talent is what is difficult. And but when we speak about India, majority of our tech team is based out in Bangalore, India, and most of them are from IITs. So that gives us an edge over cost effectiveness when compared to the US. And moreover, they also help us build some really complex algorithms that have helped us develop the use case that we have in the most best way possible. So that's all I would want to add on it.
Got it. Sorry, Meenakshi.
Yeah, so like one point of view that I wanted to add here was like obviously there are hiring challenges with engineering, but we do have talent in India, right? And these are passionate people who are good at their work. What we don't have, and that's partially to be blamed on the education system, is people who are able to make a process of their talent, right? That's more common in the US. So people who are able to, consistently follow a process to turn around high quality, in our case, either a engineering product or a radiology report, right? That's what is specifically lacking in India, right? And for that, what we're doing is we're finding mentors and experts in the US, using that information, training our folks to, to create a process which then makes it easier for everybody else to, up the mark, for example. So yeah, that's, I think, one way to go about it.
Yeah, I think India, on one hand, we have unemployment problem. On the other hand, we have problem of people not being so talented enough to be hired in, for example, deep tech. So I think need to fill in the gap. Maybe Purple Tutor can, train more people. So I think switching from talent to VCs, because I think not many VCs in India, except IvyCap, get deep tech companies, and how when you guys went out pitching, is it changed, or is it still the same? Because I mean, I've been VC for 10, 12 years, but a lot of people understand consumer business very well. But when you sell something like Trillbit, they're like, okay, I don't really get it. So what's your experience been?
I can tell you, first of all, really happy to have IvyCap as our lead, and I think you're also game changers as we went further out into the market to raise the rest of the funds. It was a struggle initially. I think the fact that we are a little bit lucky where we are actually making money while creating the data is very helpful. So for us, I would say most probably, because we're not burning cash, let me just put it simply, we found a lot more takers. And as you said in the beginning, the buzz of drones opens up a lot of doors. It's the flavor of maybe the last 6-9 months. I don't know how long it'll last. But I wouldn't say we found it as difficult as potentially maybe some other ones who are only focused on deep tech and may need some initial investment compared to getting the revenue and the funds later on.
Great, excellent. Do you want to answer that, Meenakshi? Because you're healthcare AI. Same question, and then I would love to open it for audience as well. We have some time, but first you can.
Yeah. So data definitely comes easy to India, right? Like in our context, if I were to put numbers, for example, if I were to source MR scan data from US, it'll cost me like $25. In India, our average cost has been less than a cent for preparing that data for AI algorithms. And we've gotten quotations from everywhere, right? So the cheapest quotation we got was from a Syrian refugee camp for preparing data, and that was $10 per hour. We do that in like less than $2 an hour in India, right? So that's the kind of difference we're talking about when it comes to data. We definitely need to work from our strengths, and data is one of it.
Great. Love to open up to audience if somebody has a question. Yeah. Mike didn't.
Can you tell something on the latest rules on the importation of the drones component and the manufacturing thing? Because a lot of talk. In fact, I believe that drones will create largest amount of employment in the next 5 to 10 years, just as delivery boys did it. I think people have not understood the importance of manufacturing as well as the applications. So I just want to know if you have any reflection on the latest
Yeah.
regulations on that?
We obviously know the regulations and what is ever changing. I've got to cross my fingers with respect to your statement of drones potentially being a lead employment generator, and that's only going to happen if the actual usage and their business is willing to pay for it, right? Otherwise, it's not going to generate the employment that you spoke about. Coming to your more specific point about the regulations and the import of drones, there are manufacturers. I would say that there are some of them who are manufacturing really good quality drones, but they're not being able to match the pricing that is there internationally, so we're going to have to end up paying a little bit more. Very specifically to our business, we don't face too much of an issue, right? Because if I have, let's say, 50 drones and I have 200 working days, I can do 10,000 missions in a year. 50 drones is not a big deal. We already have about 12 to 15 of them. So the fact that a drone can be used repeatedly again and again, even if you take 3 days a week, that's still 150 days a year. It's not much of an issue. And the import of the components, whether it's batteries or propellers, which finally have a life, right? We have to replace them every 2 years or 2.5 years. They're not expensive. That is freely imported. So that they actually clarified, which made it really, really easy for us to buy locally. And if our volumes really go up, we may import it directly from a dealer, but the margins to buy it locally is not that much. If I keep YelloSKYE aside for a second, I think this is a really good test for the manufacturers because they're going to have to up their quality if you want to start doing square kilometers and hectares and districts and states with respect to data capture. So you want to do really, really large areas but still continue to have the same quality. And there are very few people, Indian manufacturers, who can do that. But we can see them upping their quality, which is a good thing. That's my view. So it's forcing the industry because the final client is not going to pay if they don't get the quality. And I think everybody here and on this panel knows it. If you do not get your data capture quality right, I can process, I can do what the crap I want, I will not, it's just garbage in, garbage out, simple. I will not get the quality I want and I will reject that drone.
Yeah. It's like what you capture, yeah, that's important. There is one question in the back there. Can we get the mic there or?
First question was on drones, so the buzz continues.
Yeah.
Hi, my question is to Mr. Tarun. I've been following a lot of mental health platform, and especially after COVID, a lot of companies have come up solving this issue. So what's the trend that's happening in the market, and how are, with so many players making this space very crowded, where is the differentiation?
Thank you. I think with COVID, what happened was a lot more people started talking about mental health, and a lot more platforms came on, to help with mental health. But at least our thesis is there are two big problems that anyone who wants to solve for mental health in India will have to solve for. Number one is unawareness. While we talk about people, more and more people seeking help, you have to realize that of all the people who get affected by mental health issues in this country, only 20% are even aware that it is a mental health issue. The rest of the 80% don't even know it's a mental health issue and don't end up seeking treatment for it. Second, of the 20% people who are aware, half of them don't want to accept that they have a mental health problem and go to a mental health practitioner. So when you combine these two challenges, any platform that wants to really scale in this area has to solve for these two. The approach that we've taken in our case is you will have to partner with mainstream healthcare, because a lot of people who don't directly seek help for mental health, they seek help from their general physicians, from gynecologists, from any condition that they are suffering. And then, the transition to mental health care can be facilitated. Direct B2C will be a challenge for some time.
Got it. I think we get just one last question we can take.
My question is to Meenakshi. See, I just want to understand that because, your whole venture is, using the artificial intelligence to report the spine, imaging of spine. Now, the data becomes very important in spine. And in India, see, we don't have a standardization of data. Because, see, if you look at that, the MRI 0.5 Tesla to 3 Tesla. So data comes from 0.5 Tesla, 1 Tesla, 1.5 Tesla, 3 Tesla. So now, and especially in the spine, the 0.5 Tesla is different, 1.5 Tesla different, 3 Tesla different. So how do you standardize the data? Because the AI will require a data of normal, abnormal, and then, your things are. The second issue is that the spine requires most of the time clinical correlations to give a good reporting, So what do you do about that,
Right. To your first question, like brilliant that you asked that, because fortunately for AI, it is better that we see all kinds of machine strengths. So standardization in the sense of Tesla strength, 0.5, 0.3, 1.53. It actually is better that the AI algorithm learns from all that kind of variation in machine strengths, because then we are able to produce algorithms that generalize much better on any kind of incoming data, right? And that is actually a strength. So for example, parallel company sitting in the US working only out of 3 Tesla images will have much poorer generalization capability than algorithm like ours, where we are training on all kinds of resolutions, right? Even, here you were only talking about Tesla strengths, but we also see variations in how the DICOM itself, so the scan itself is captured, right? Technician mistakes and etc. All of that also is something that we counter for. So it's actually a strength, right? To your second point, so I understand we need clinical correlation in a lot of cases, and hence we do source both the plain radiology reports and the clinician opinion on the same. However, to be honest, we're not focusing so much on clinical correlation as of now. Like from algorithmic perspective, from a data perspective, we do feed that information to our algorithms so that we make clinically relevant decisions. However, like in the next step of evolution, what we want to do is basically automatically also predict the kind of clinical symptoms that a patient would see, right? And that doesn't really happen in, even in normal reporting scenarios with radiologists these days. Like, not these days, like in general, right? With a completely manual mode of working. So.
Thank you, Meenakshi. So one thing is pretty clear, we are moving from, arbitrage to IP, and these are the folks who are doing it. So big round of applause for them, and thank you so much. Looking forward to your progress.
Thank you so much, everyone, for such an enlightening conversation. Meenakshi, you, Tamanna, and Neha remind me of a very famous quote by Hillary Clinton. Women are the largest untapped reservoir of talent in the world. And it's so great to see entrepreneurs like you breaking that norm and making for the women power. Thank you so much. Requesting Tej to please hand over the token of appreciation to all the panelists. Can you please have the token of appreciation? Thank you so much, everyone. Madhuri, over to you.